So what's the future of health care in the United States? That's a huge question with all of the threats to repeal and replace the Affordable Care Act. Joining me now is Dr. Vivian Ho, Chair in Health Economics and Director of Center for Health and Biosciences at the Baker Institute of Public Policy at Rice University. That's a mouthful.
It is.
But you're doing a lot. Thank you for being here. So this health care, there's so much uncertainty about what's going to happen. Do those of you who study this on a day-to-day basis have a sense about how this is going to work itself out, or is it still up in the air based totally upon the political atmosphere?
It's based on the political atmosphere. The only person who knows what's going to happen is the person with the crystal ball, and I'm looking for that person. Haven't found them yet.
This whole thing, though, with the Affordable Care Act, most recently the Republican Congress has said we're going to repeal and replace. And the effectiveness of them being able to do that is questionable at this point. The latest I've heard is that they want to repeal a part of it and then kind of replace it eventually. I've seen reports that that is not a good idea. What kind of expert analysis is there of that possibility?
Well, so the Republicans have realized they cannot fully repeal the Affordable Care Act.
Why can't they?
They would have to be able to break a Democratic filibuster to do that, and they don't have enough votes in the Senate to do that. But they have figured out that all they need is a majority vote to do something called a budget reconciliation. The budget reconciliation still can strip the most important parts of the Affordable Care Act because it has to do everything to do with financing through the act, which means that they could completely eliminate the subsidies that people have been receiving to purchase health insurance, and anything else having to do with financial consequences. And so the risk adjustment, payments to insurance companies and all this could be stripped. And so that really makes the Affordable Care Act impossible to function, the insurance component part of it.
I've heard that the insurance companies, though, they are skittish about what may happen depending on how the Republicans decide to do this. And so they're unsure about what they're going to do, and that kind of makes everything unsure, doesn't it?
Yes, yes. I think the scary thing is that Mitch McConnell, announced yesterday that the Republicans, their first priority when they get in power in January is to pass budget reconciliation and repeal the parts of the Affordable Care Act that they can. And they said, well, we'll still be rational and we'll make this repeal effective, say, in 2019 or maybe 2018, all right? And then we'll just continue with what we have right now. But if I were an insurer and I were looking at that, said, well, you've got a market that's going to last for 2 years at the most, and I'm not really making money, and in many cases I'm losing money, I'm just not going to continue with this product. It's not worth the long-term investment. If we have more insurance companies pulling out, that leads to less competition in that market, which raises premiums, and that then causes higher prices.
And more uninsured in the process.
Absolutely.
Down the road.
And there are people who misunderstand. They're thinking, well, if this Affordable Care Act is going away, then I don't have to buy health insurance. There are many people who are unhappy about the mandate to purchase insurance under Obamacare. And those people, I'm sensing already that some of those people are choosing not to buy health insurance right now. What they don't realize is they will still be subject to a tax penalty. The IRS is still required to tax them as long as that portion of the Affordable Care Act is in place. Now, suppose Congress gets up and says, well, we'll repeal that part, and so you're not required to pay a penalty, you don't have to buy health insurance. That means all the people who are relatively healthy who don't want to buy health insurance are going to pull out. You're going to be left with a sicker pool. That is also going to raise the average cost of health care, which raises premiums for everyone, and we call it a death spiral. So it's unless you actually have the plan in place that the insurers can respond to, as rational, efficient, business people can, the uncertainty is going to be too much for them, and those insurers who are in this to make a profit will pull out.
In the meantime, state of Texas continues to be the lowest in terms of the last place in terms of numbers of insured or uninsured in the state of Texas. The Affordable Care Act, what kind of impact did it have on the numbers here in Texas, and now going forward without the Affordable Care Act, what's likely to happen?
Well, the subsidies were very generous for low-income Texans to purchase health insurance. If you were between 100% of the federal poverty level, or say 150, 250, you got a good subsidy. So we published a study which showed that since 2014, when the insurance provisions took effect, 1 million extra Texans received insurance coverage on the Affordable Care Act. And so there's an analysis that has just come out yesterday, which by the Urban Institute, which predicts that the number of uninsured in Texas will actually double by 2019 if you completely repeal the Affordable Care Act and don't replace it with anything. In fact, it will be worse than what it was prior to Obamacare, simply because we've actually changed the individual insurance market so much through the law.
What was the original impetus for people saying, okay, we hate this Affordable Care Act? We hate it. We've kind of forgotten about, it's been a while since it was put in. What was the original thing that really made people hate this and be so adamant about repealing it?
I think, unfortunately, there was a misunderstanding in the population. Everyone hates their health care costs now. They are high. They are unreasonably high. They were high before the law. And the problem is we're only slowly working away at reducing that waste and high costs. There's 20 to 30% of healthcare costs which are waste. And so people associated that increase with Obamacare. And so they blame their high healthcare costs on the law, when really that's not true. Actually, the law has done some good things in terms of controlling costs per person covered.
We have a lot more to talk about. I'm going to ask you to do a Newsmakers Extra with me today so we can talk more about this, because we've just scratched the tip of the iceberg. There's so much in her, we got to get it out. But thank you for doing that. So we're going to ask you to go to clicktohouston.com and we'll show you how to get there. You go to our website on Newsmakers.